question is kind of lymphoma focused or leukemia focused. Either one of the leukemia or lymphoma doctors can take a stab at it based on your practice. Mostly towards lymphoma, I would believe. This is a question on CLL. The patient says, I have CLL since 2018. A month after diagnosis, I developed systemic neuropathy. Several doctors do not have answers for me yet, and recently I was told that I could have potentially CIPD. Is the association of systemic neuropathy or CIPD common with CLL, and if so, what is the treatment?
Okay, so I mean, I can take a stab at it. I would say, like, in general, it's not very common, but it doesn't mean it's not associated with CLL. So the way I like to think about CLL, the same way I think about all kind of lymphomas in general, is your immune system is not functioning 100%, right? So CIPD really can be thought of kind of like an autoimmune disease that's affecting those nerves. In general, the treatment is to try to treat the CLL, try to see if they can fix the immunodeficiency problems and see if that neuropathy can be reversible. I know there can be other causes that are not CLL related. I'm definitely not an expert in those sorts of treatments beyond, trying to treat the underlying CLL. But we do see, with CLL, you can see a lot of different sort of autoimmune problems. Like you can get autoimmune hemolytic anemias, you can have, warm autoimmune hemolytic anemia. Sometimes you can have cold agglutinin disease. You can get these sort of bizarre manifestations of, regulatory problems.
Yeah, and I'll take less of a stab at that question because I wanted to mention that even though CLL, the last letter is leukemia, the second letter is lymphoid. So actually, CLL is thought biologically to be more similar to the lymphoma diseases rather than the other leukemia diseases. So at our institution, actually CLL actually is its own group because we've developed ibrutinib, but the CLL has naturally been treated by the lymphoma groups. And I would have said mostly the similar sentiments as Dr. Sanchina, but overall, there are a lot of confounding factors, and really it's hard to give you a lot of medical information without full context, and you should see your primary physician as well too.